But that's exactly right. That what you're talking. That's why a lot of times what's happening is most pediatricians or neurologists, they don't have that knowledge base yet. It's relatively, it's not that it's new. It's just awareness of this subject is starting to become more and more popular. I would say, like, people are becoming more aware of the need to provide the right input to the sensory system, how important sensory integration treatment is. Now is when that awareness is coming around. In the past, what was happening is you would have these children that were diagnosed with autism, and immediately they would refer either to a behavioral therapist or to a speech therapist. Rarely would they start with an occupational therapist. So they were skipping the most important part. It was pediatricians and neurologists were referring to, again, like behavioral therapists and speech therapists, and they were skipping the foundation that was needed, which is the occupational therapist. If you don't have a good occupational therapist, you are missing such an important developmental stage for your child. If they don't organize their sensory system, everything else is just going to be so much harder, if it even happens. So it just depends on the level of sensory dysfunction that your child is presenting with, whether or not they're going to be able to acquire, despite their sensory dysfunction, a little bit of speech, a little bit of language, a little bit of academics. But in reality, what they need to start off with is always the occupational therapist, which is why our group in particular, sensory is our passions. Being able to provide the correct sensory input, understanding sensory integration dysfunction, what is actually happening with your child. That's why having a good OT that understands that is key for us to be able to do our job. Otherwise, our job is so much more difficult. So it's really important for pediatricians to educate themselves a little bit more about what sensory integration therapy is, what sensory dysfunction is, and who to refer to. Neurologists should also have a little bit more knowledge base about that as well. And speech pathologists and behavioral therapists and teachers should also have that understanding, because we also need to know when to refer to an occupational therapist and how necessary and beneficial it is.